Good afternoon. I'm Kyla Graham, and the topic I chose was healthcare. And I went into depth as far as this blood crisis that we're in. There's currently a shortage of blood. Current news: there is currently a decrease in the donation of blood by 10%, and some of this is due to COVID. The issue has gotten to the point where healthcare workers are having to ration the supply of blood to patients. Social problem, human rights issue. Why is the shortage of blood such a human rights issue and a social problem? This crisis is a human rights issue and a social problem because blood is needed for people daily. There are many people who suffer from ongoing health conditions and they need blood transfusions. But then on the other hand, you have accidents that are happening and it is life or death for people and they need blood as well. Without enough blood, healthcare workers are having to decide who needs it and who doesn't, which is crazy because whether it's a health issue that's been ongoing or an immediate surgery or procedure, if someone needs blood, they should be able to receive it with no problems right then and there. They shouldn't have to wait, or healthcare workers shouldn't have the burden of having to ration blood. NASW. They help provide health insurance to those who are not able to find it themselves. They point people in the direction of whom they can receive affordable or even free health care from. And they also help people understand their rights. What I mean by people understand that they have the right to seek any type of health care if it is needed, whenever it is needed, how it's needed. Social policies. Donor History Questionnaire, or DHQ. The FDA has recommended that the policy include donors to basically include any sexual context they've had within the past 3 months. They say that this will help prevent taking blood from anyone who has contracted HIV, AIDS, or anything like that. Basically, the DHQ, being that they are including this into this questionnaire, I feel like that it will help tremendously because the time that is spent on taking blood from someone who has been contracted with that virus, HIV or AIDS, and realizing that they do have this virus, their blood cannot be used. Whereas that time spent could be spent on taking blood from someone who has blood that can actually be used and put towards a patient or a person that actually needs it. It can be helped right then and there. Blood type update. The U.S. Senate office has asked for people to make sure that they know their blood type, as well as that it's updated in any of their medical records. Knowing your blood type is super important. This just helps healthcare workers save time and not be trying to search for a blood type that you think you are when they probably already have the blood type that you actually are, and they're spending time trying to find a type that you aren't actually, you don't actually have. Discussion questions. So, as a nation, what can we do to help the cross as well as other blood centers? What I mean by this is, how can you as a person, how can you help? How do you think helping will help others? How can we prevent our nation from having this problem in the future? Of course, the pandemic has caused people to feel like donating blood, it's scary. We're in the middle of a pandemic. They may feel like they can actually catch COVID from donating blood or from getting blood from someone who's donated blood. But how can we prevent this in the future? How can we, let everyone know donating blood is helpful, or let them understand that they are helping? These are all of the references and resources that I used while doing this assignment. My favorite one would be the second one. It is from NBC News. It's just a video of healthcare workers saying how they are being put in the situation to choose, who gets blood, and as well as it is also volunteers from the Red Cross saying how critical this blood shortage is.